Bruce Stafford received his Bachelor of Arts degree from Middlebury College in Vermont. He then received his first master's degree in social work from Florida State University. He received his second master's degree in psychology from the Fielding Institute in Santa Barbara, California, where he maintained a 4.0 grade point average. Bruce started his counseling career in the military, where he was commissioned a first lieutenant in 1981 and promoted to captain in 1983. He was awarded the Air Force Commendation Medal for meritorious service in December of 1984. Bruce then worked at the Naval Training Center in Orlando as a counselor to naval personnel and their families. After 3 years, he was promoted to supervisor of the counseling department. In 1989, he entered full-time private practice and had a full caseload within 2 months. He has now been in private practice for almost 25 years. Throughout that time, he has continually sought additional training and knowledge to improve his skills, searching for the most effective ways to change people's lives. It is this drive and compassion that are the hallmarks of his practice. Let's join Bruce now as he explains the various methods he uses to treat his patients.
Hi, my name is Bruce Stafford, and although I hate to admit it, I've been practicing psychotherapy for over 30 years. And during that time, I've always studied new and innovative techniques because I like to create deep and rapid change. Because as I watch people change rapidly and deeply, their lives become more fulfilling, and it makes my work more fulfilling. I have combined several therapeutic approaches that accelerate the change process while creating an environment that feels safe and nurturing, because I've observed that people that feel safe change more rapidly. People report that these techniques are very effective. They look back and often tell me it's the best approach they've ever experienced, and they report that it's much easier than they thought it would be. Now, these techniques work for a variety of conditions, including anxiety, panic attacks, phobias, depression, unresolved grief, addictive issues, and post-traumatic stress disorder. Now, a little history on how I came to work the way I work. I was originally extensively trained in something called redecision therapy, which looks at the decisions that we make as children that are dysfunctional. For example, if a child grows up in a family where they have to be perfect because of a critical parent, for example, they may decide that they have to be a perfectionist. Now, through redecision therapy, they can redecide and become an imperfectionist. I then studied something called EMDR, which is a technique that removes the pain from traumatic memories very quickly and effectively. I then studied hypnosis for years, and then for the last 5 or 6 years, I've studied something called rapid trauma resolution, which was originated by John Connolly. And the last 4 or 5 years have been my most productive in terms of my ability to help people change. Now, what rapid trauma resolution does is it will take a painful memory in anywhere from 5 to 15 minutes after you've gotten into a rhythm. You can erase the pain around that memory. And when you erase the pain from that memory, what happens is the memory is rarely, if ever, recalled. I've combined all these techniques, and they work on specific traumatic memories, or they also work on repeated or replicated memories. Say, for example, if a child grows up in a home and they repeatedly hear in one form or another, either from a parent or a peer group, that they're not good enough. They may grow up feeling inadequate, or they may even feel uncomfortable in social situations. Now, these memories are first removed individually, and then when the person gets into the swing of clearing out these memories, they can be cleared out in groups. Memories of a similar structure can be cleared out in 1 or 2 sessions, thus even making the process go faster. Now, as these memories are cleared, the person's internal perspective begins to change, and someone who may previously have not felt good enough begins to feel good enough. And then their anxiety reduces, their self-esteem increases, and they feel more comfortable with themselves and others. Hypnosis works for a simple yet profound reason, and I didn't even know this until a couple years ago. Your conscious mind is extremely time sensitive. However, your unconscious mind is not aware of time. So what happens is, if a painful memory gets lodged in your unconscious mind, your unconscious mind plays it over and over again in an effort to get you to change it, and you can't change it. So that just creates unnecessary anxiety and a lack of focus. It's sort of like going over a bridge for 20 minutes, and your spouse pulls out a map and says, turn left, and you go, when? And they go, 20 minutes ago. And you throw up your hands. There's nothing you can do about the past. Now, the nice thing about hypnosis is it's actually relaxing, and it allows you to separate the past from the present and the present from the future, so that you can live fully in the present moment, the only moment that exists, so that you can have a full and passionate life. Now, the nice thing about this approach is it can be done in traditional hour blocks, it can be done in 2 or 3 hour blocks, or it can even be done in half-day sessions, so that the change can be done extremely quickly. I've never been more optimistic about helping people change so that they can live happier, more fulfilling lives, lives that are focused on the present moment, the only moment that exists.